And I tell you, I'm super excited. This topic, okay, when it comes to pregnancy and hair, in pregnancy, it's the excitement of the birth and what's to come, what's to expect, not to expect. And so when it comes to women, our hair, we're just, and because we know and have grown to know that the hair is going to soar, it's going to grow, and you're just excited to see what's going to happen. But in that growth, and after the delivery, some things kind of change and happens too. So we're going to discuss that as well. But Dr. Nikki, when it comes to hair growth in pregnancy, what are some of the things that the body goes through to produce that growth?
So everything's kind of around supporting the fertilization. It's all about that. So there are certain things that need to happen hormonally to really have the optimal environment for the egg to continue to grow into baby. So in the first trimester, there's going to be surges of androgens and estrogens. So these particular hormones do fabulous things for the hair, nails, and skin. Okay. So estrogen can help with thickening hairs. It can help with prolonging hairs into a growth phase. And then your androgens can actually help with increasing the growth rate. So that's when a lot of ladies are starting to notice that their hairs is growing like it needs to, getting a little extra length going. Yes. They also notice their nails getting a little thicker and their nails are getting strong. And their skin, that's when they get that glow. They start getting that glow because it starts doing some fabulous things to their skin too. So with that being said, usually the first trimester is when all that's happening and changing. And then going into the second trimester, there's a little bit of just kind of the plateauing of the hormone levels. And then after pregnancy, we go back to our baseline. So now we've lost that extra luster of the estrogens and the androgens in the area. And we can talk a little bit about how you can kind of prolong that, which is good for baby and good for you. But in the beginning, it's those estrogens and those testosterones and androgens that are really helping with adding some amazing effects to the hair, nails, and skin.
Yes, and during that time, you're eating the right foods. Okay, that's that support from the inside out. So, and then you have, along with that, you have all of the manipulations and things that you have going on, from the body massages that your mate is giving you, just all of that extra love and care, no stress. Should not be during that time period. So all of that is building up. It truly takes all of that, the entire environment, to create that growth. It's no stress. It's the nutrients from the inside, and then what the body is producing from the inside, that blood flow, the richness that's in the blood. And so now, when you actually go through that delivering process, okay, going through that delivering process, you deliver the baby, and then you start noticing the shedding of the hair. Dun, 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 dun.
Yes. So it's not a gradual wean down. It's all of a sudden an abrupt removal and drop in some of those levels. Yes. So it's that abrupt change that starts to affect the hairs. So now we've prolonged the growth phase. We've increased the growth phase of those individual hairs. Typically, someone will have about less than 10% of hairs in a shed phase at any given point. That's why you'll lose 100 to 150 hairs a day. Don't collect that because it looks terrifying at baseline. So once you are now in that abrupt change and shift in the body, hair is fickle. It doesn't know what's happening. So now you've removed all of those points that are keeping those hairs in the growth phase. So now they're going to go into a shed phase. So now you don't just have 10% going in a shed phase. All that hair you've been holding and maintaining, all those strands, the 100, 150 on a day-to-day basis, times 9 months, they're all going to slowly, one by one, start to shed and kind of go back into their normalized phases of the growth phase, rest phase, and shed phase. So usually that can last up to 3 to 6 months for a lot of ladies. If you get into a chronic shed phase, that can last past that duration of time. And that's when it becomes very upsetting, very stressful, because you just see hair coming out by the handful.